Hello everyone, welcome to Public Accountability meeting for February. I will start straight into attendance and apologies. The apologies are from Julia herself, hence why I'm in the chair, and from the Chief Fire Officer, but John is here for us. And that's it for apologies, but attendance I'm Will Naylor, Deputy Police and Crime Commissioner, and to my left we've got
John Foster, Deputy Chief Fire Officer.
James Manning, Group Manager for Harrogate and Craven.
Tom Thorpe, Policy and Scrutiny Manager for the Commissioner.
Charlotte Bloxham, North Yorkshire Police, Superintendent in charge of Operational Technology.
Mark Carn, Superintendent in charge of Partnership Hub.
Phil Kane, Deputy Chief Constable, North Yorkshire Police.
And Lisa Winwood, Chief Constable, North Yorkshire Police.
Thank you very much. Minutes we don't do because it's all recorded, so anyone can go back and watch any part of it they like. So it will be very accurate, I think. And actions, we did have one action which was around a additional slide on drugs, which is in the performance pack, which we'll come to when we get there. So that's been part completed, but I'll explain when we get there. Questions from the public, Simon? Have we had any?
No, we haven't had any.
We published the answers to the questions we had in January. Excellent. Right, but we'll move very swiftly on ahead of time to item 4. The topic today is ambitious collaboration for both services, but
do you want to lead on it?
No.
Do chip in. So
I think Mark does want to lead on it.
No, I do not.
See
No. My name's on there because someone put that on, but I didn't.
I shall start the presentation, and then obviously there will be lots of detail from a partnership hub perspective that Mark might want to expand on, or if there's any difficult questions, Mark can answer them.
Of course.
So, in terms of the strength of our ambitious collaboration, from the police and crime plan and the set of objectives sitting underneath that area of business, there are a vast number, I would suggest, of collaboration projects, initiatives, work that's going on out in our communities. So we've selected just a number of those to give you a flavour of, so that you can see the breadth and expanse, if you like, of some of that work and some of the partnership arrangements that people might not recognise from a policing perspective, but actually is about keeping our communities safe and making them feel safe in partnership with others. So if there are any others people want to ask about, we can delve into those. So the first one I want to talk about is a collaboration with TUV, which is Tees, Esk and Weir Valley, and Vale of the opposite, Valley. A CCG. So this came into being in October 2019. So this is a custody suite and court proactive initiative for detainees. So we engage with individuals with mental health issues, drug and alcohol addiction, unemployment and housing problems, because these are some of the root causes that cause people to come into contact with the criminal justice system. So instead of just dealing with the reactive part of people who have already entered into the criminal justice system, this is about looking at the root causes and the prevention and early intervention opportunities of preventing those people coming into a criminal environment. So we look at signposting people to statutory and third sector services. There's some anecdotal assessment as opposed to a formal evaluation yet, given it was only implemented in October last year, but there will be a formal evaluation of the outcomes. But as you'll imagine, the longevity of a project like this requires the opportunity for those initiatives to start to impact on the person's life before we can truly measure whether they will re-enter into the criminal justice system. So rather than a short-term solution, we're looking to see in partnership the longer-term diversion away from some of those issues that cause people to come into contact with the criminal justice system. So that will develop as we go along, but is a really good initiative to support people in some of their root cause needs in society.
So is that strength just because you're doing it, full stop, or are we doing it well? So I ask, for example, around female offenders, where there was a liaison, and I think we've discussed it here before at some point, but where there weren't many referrals going through despite lots of effort. So what is it a strength just because we're doing it, or are we doing it well already, notwithstanding that you don't have all the information,
all the data,
given it's only just started?
And I think you're right, there have been diversionary schemes previously through the GATE schemes, specifically aimed, as you've said, and there now is more work around female diversionary services. It's going to be hard to tell, I think, until we start looking at what's what's the rehabilitation opportunities of people who would have then re-entered the criminal justice process, but because they've got the stability provided by the partnership arrangements for things such as housing. Housing is, for example, one of those things that the stability that creates can divert somebody's life away from coming into that cyclical nature of their criminal behaviour, but we probably won't know that until we've got a period of time where we can show that if that person perhaps would have come into custody on a regular basis, that 6 months down the line, the fact that they haven't come into contact with the criminal justice service or system, and the contact with them through these other agencies is that they have started to stabilise their life, settled into housing, got a job. It's those sorts of outcomes that will then give us the opportunity to see how successful the interventions are.
So the answer is we don't know yet.
We don't know yet. And I think the most important thing about the ambitious collaboration is this isn't something the police could do on their own. Because we've had situations where we signpost people to a housing service, but without that wraparound of the service working alongside us in partnership to achieve the shared outcomes, and people have got chaotic lifestyles and they don't report to that separate appointment. And that's why the scheme works so well in partnership, because the wraparound is there from the relevant agencies without the individual having to go and fend for themselves, if you like, with different agencies. So no, we'll look forward to the evaluation of that.
Are we seeing, is there any kind of anecdotal feedback from custody themselves yet around the impact that it's having for their ability to assess those health needs and make better provision in custody for offenders? For example, over the last 3 months, we'll see in the performance stats later, there's been an increase in the number of people who have been getting to custody and then being referred on to a health-based place of safety for mental health concerns. Is there any indication yet that that is because of the L&D services in custody that are allowing those better assessments? Or
I spoke to Rich Ogden, who's the inspector in custody, and he's very enthusiastic about it, and he feels, and it's anecdotally as the chief says, that yes, we are making life easier for the custody staff. Yes, they've got to deal with the person who comes into custody and deal with the criminal justice element, but then that aftercare that's required, that sometimes kept people in custody for longer, or trying to find routes out, or brought people back in, they're being addressed there and then within the custody suite. And I think the strength of this is that the frustrations that we felt as police in terms of people coming through a revolving door, and we don't, looking at that early intervention world, that is a world that we sit outside because we have to rely on other agencies, and to actually have TUV come into our environment and help us with our people, our demand, is a real step forward. And the reason why I've put that on there, I think that's an example of a collaboration that hopefully we can develop in other areas in policing, because just the way it works, it's effective for the police, and hopefully also effective for TUV, because it gives them their audience as well in there. So I was going to use the word captive, which is unfortunate for custody, but the people that they need to see are there in custody, and so we're sort of killing two birds with one stone.
And in terms of the ambition around that, are we, for example, are you considering, for example, other ways of using the assessments and the data that you're getting out of them? I think, for example, with the probation services or the prosecution services around identifying what kind of sentencing might be most appropriate, or things like that. Is there? Yeah,
I mean, the one element that a project that I haven't put on there, but I've mentioned it, is Trinity as well, and that's with the probation service. So, although again that's another project which works with offenders, and is in its early days, and there's a lot of teething issues there as well, there is an ability for us to use that data across the piece, as well as the wider mental health work that we're looking at. So yes, there's a real opportunity there for us.
Thank you.
Another initiative. We will speed up.
I know. Sorry.
So custody healthcare, this has come on leaps and bounds, and again, it's a much more value for money, efficient and effective use of resource as a result of collaboration. So custody healthcare previously, many years ago, used to be there was a custody sergeant, a jailer, which was a constable, and a matron or a nurse in custody, and if anybody needed any significant healthcare, you called a doctor out, often on contracted basis with expense, or you ended up utilising police officers in pairs to take people to hospital. We then looked at how do we deliver that better service without having that abstraction of officers and hospital visits, and it is absolutely our responsibility to look after and the welfare of the people who are detained in our custody. But doing that alone as a standalone for each force is probably another expensive contractual arrangement. So the collaboration opportunities here are the fact we have a regional contract with Yorkshire and the Humber through Leeds Community Health NHS Trust. So that provides a much more resilient service on a regional basis, is probably more effective than we could commission on our own as a force, particularly given our geography. So that provides that consistent service through a collaboration that is between forces, but for a service that is not predominantly seen as a police responsibility, but we do have a responsibility for those in custody. So it's just a way we can join forces with other police forces to get better value for money in terms of a contract that is something that's a specialist service that we wouldn't provide ourselves.
And are we seeing an improvement in quality as well as sort of cost?
I think what we're finding is the individuals in custody, there is a more immediate assessment of their risks and personal circumstances if they come into custody with drug or alcohol concerns or medical issues that we would ordinarily have had to transport them to hospital to be dealt with, or call out a doctor. And when you look at some of the pressures on the health service, is probably not the best use of other public services either. The fact we've got a contract that's a very bespoke service that is trained and skilled to deal with detention-related healthcare issues is a real benefit, because quite often you'll call a doctor out and their primary role is not dealing with people in custody, it's a broader role as a health professional. So having that dedicated service that understands the needs of detained people and the need to assess their suitability for interview or whether they're fit to detain is a real benefit. In terms of the statistics and the measurements,
No,
I
no, no, and I'm not saying you should. I'm not going to say what I was going to say.
Cost-wise, I think there'll be documentation that shows the cost of procuring that service ourselves versus doing it as a part of a regional contract is better value for money from a procurement perspective. Do the people feel better in custody?
The reason I ask about quality is this is relative direct way of putting it, but you, as a result of some of these things going wrong, you can die. So people die after police custody or just after police contact.
Mm-hmm.
So it's about the sort of understanding the not just the day-to-day quality of that, but where it can go wrong and the accountability frameworks that go with it and things. But I know it is a much better value service, and the general level of service is better.
So appropriate adult arrangements, this is a subject that was discussed probably at a previous PAM, I would think, but quite a long time ago, about when we have either young or vulnerable people in our custody, the length of time that they are with us as a result of us struggling to acquire, if you like, appropriate adult arrangements for those individuals. It's not right that those people should remain in our custody longer than necessary as a result of appropriate adult availability. So again, another collaboration with our council partners in City of York and the OPFCC to ensure that those gaps are filled by a dedicated service where there are nominated people who will come out and support the appropriate adult requirements of people in our custody rather than having to wait for that service to be provided. So that's, I would imagine that can be measured by the length of time people are spending in custody in comparison with previously.
It is a challenge, so it's something I work on outside of this meeting quite a lot, and it is better, particularly in the City of York where it was bad for a certain period of time. I think the issue now is for all appropriate adults, whether it's for young people or vulnerable adults, is out of hours, which I think is proving a challenge at the moment.
Yeah.
So whilst it has got better for appropriate adults, for vulnerable adults, there is still work to do on that front, I think.
Absolutely, but this has to be a partnership arrangement.
Yes.
Police,
for the independent, yeah.
Absolutely, the Police and Criminal Evidence Act, and obviously is now a fairly well-established document, even talks about the opportunity for the police to walk out and grasp a member of the public off the street to be an appropriate adult. So we're a long way off seamless arrangements being put in place. But that is what's required, and of course it's not appropriate for the police service themselves to be the appropriate adult. So it has to be in partnership with those agencies who've got the skills to deliver that and the independence from the police investigation.
Yes, and more forces and commissioners and local authorities are commissioning services to that respect, rather than relying on either local authorities or volunteers or whatever. So that seems to be a growing appetite for that.
Community safety hubs is a subject that's been discussed many times. They exist in various forms in North Yorkshire. We often talk about the Scarborough model in terms of that's probably got the broadest number of agencies sitting around the table within a local authority building. I think the results speak for themselves in terms of some of the performance data we've seen in Scarborough of dealing with some very vulnerable, hard to reach either individuals or communities where they've seen much better quality of life outcomes for those people than if we'd have dealt with it separately as individual agencies. But there are a variety of models. A research study was conducted, so there is some data around this. A research study was conducted by an intern that worked with us within the Partnership Hub from a health perspective, or came from a public health background. There is more we can do on community safety hubs, I would suggest, but this is linked to the broader direction of the police and crime plan in partnership working, sharing buildings and not just being in the same building, but working in an integrated way with other agencies. So I think this is one of the areas that is probably untapped in the extent to which we could achieve much more together as partnership. But I think our estate strategy and the police and crime plan and the strategic direction of the organisation is actually working towards the development of community safety hubs in a much broader sense. ORCUMA is a system, so this is really a flavour of the collaboration that isn't just all the same sort of collaboration. So ORCUMA is a collaboration in that it is a technical solution to sharing information across platforms. So this is where community safety hubs can share information between agencies on the same system. I think it's been a painful process, is how I would describe it, in terms of trying to risk manage confidently the GDPR and firewall measures around community-based information sharing systems. But we've got it. I think it took a long time to bring in, but it is creating an opportunity for people to access information that they wouldn't normally be able to share without physically sending something across the airwaves to somebody else, and it's all on one platform.
And we're confident that all the different hubs are effectively using it.
I can answer that. I went to a meeting yesterday about community safety hubs, and I think there's a recognition in the hubs that we're all working differently and we have to do something to move things forward. ORCUMA is seen as a vehicle by which we can do that, certainly around case management, but there is a definite understanding that they're using it differently in each of the hubs. So what we're looking to do in terms of the CSP is to identify, this is going to Peter's report that you mentioned, ma'am, identify a single means or a consistent means of understanding risk across all community safety hubs, a consistent way of using ORCUMA to manage cases, and then once we have that, and outcomes. So identifying what the outcomes are across all the community safety hubs. And once we have those consistencies across ORCUMA, the way we manage risk and the way we manage case files and how we use ORCUMA, then that localism can come in, because my observations are that they're very locally driven. I don't think that comes as a surprise. Each area has their own. I've got to use my words carefully here. They have their own sort of ways of working, and they want to stick to those ways of working. There's nothing wrong with that, but we need to make sure that ORCUMA and things like that are used consistently. So at least we can compare one hub with another, because at the moment we can't. And that was an agreement yesterday, broad agreement amongst the community safety hubs, that that's what we need to do as a strategy for the next 12, 24 months. So keep I'll keep you posted on that one, but that should be developed through Odette Robson. So, sorry, back to your question, Tom. No, it's not being used consistently.
Okay.
But do we know? Yes, we do.
Okay,
Thank you.
and street triage is something again that's been spoken about here, particularly some of the mental health performance data that we talk about. So there's an opportunity for us to ensure that people are directed into the right services. So police officers do obviously attend crisis situations, but the street triage staff, and that's obviously at point of phone call in the control room, but also physically out on the ground in certain locations across the force. It means that people are suffering a health crisis, and the police might need to be there for the immediate crisis intervention, but actually the longer term systems approach to that person's needs should sit with a health professional. So the street triage provides that opportunity at first point of contact to have that engagement with the person, rather than it being a secondary intervention when the police have been the people are actually working alongside us hand in hand. And this is about putting the people that we serve at the very centre of our service, because the best service for them has to be the health intervention that they need, rather than a police officer. And although we've provided training and support for police officers to have more awareness of mental health crisis, we're not the health professionals in terms of the longer term interventions with those individuals. So that's been a very successful intervention. It has been measured in terms of some of those outcomes. But again, I think in terms of ambitious collaboration, there's much more we could do. And I'll probably cover some of that when we move on to the challenges of collaboration in terms of funding and other agencies, performance measures, and where the focus is, comes into some of that opportunity to expand on that partnership service.
So North Yorkshire Police done a huge amount around mental health over the last 7 or 8 years, loads. Some of that, lots of that collaboration, some of it sort of in isolation, which isn't a bad thing, so you need to do that as well. Do you think on a sort of strategic front, policing, and I suppose you can only speak for North Yorkshire Police, has done enough to evidence and encourage with partners the impact mental health has on policing services? So we see things like, I don't want to jump straight from mental health to crisis care, but things like places of safety closing in other areas, and whether we've done enough to really explain the impact mental health has on policing, and that real strategic collaboration that we need to work together to provide these services for people hand in hand, rather than sometimes working at, not on cross purposes, but with slightly different aims in mind.
So I think there's a whole piece of work that's emerged nationally, and I might be wrong in this, but some of it did come out of the work on force management statements. So as a result of forces undertaking a force management statement assessment, and we're now on year 3 this year, so 2 years ago now, we had to articulate the things that create the most of our demand and take up police officer time. So what is it that causes our demand to come down the track? And as a result of mental health nationally coming out as one of those areas, there was then a piece of national work undertaken. So we've submitted national statistics around ambulance transportation of mental health, the number of hours that police officers are spending supporting the mental health process in terms of A&E and places of safety, community healthcare, because the strategic direction of the health service is care within a community setting for mental health, rather than institutionalising people on what we would recognise as secure units or mental health wards. That is not the strategic direction of the health service. So I think that it's a very visible issue, and I think the documentation that I've seen suggests that the direction of travel nationally is to increase and uplift the amount of mental health community assets that are available to support that community care, but because of the lead time of that very specialist role, there probably won't be the full services in place for another couple of years, 2022, 2023, in which case it's still having an impact on the demand on policing. And on the individuals, most importantly, that are in this cyclical situation of the police attending when the system's approach to their healthcare. But of course, as you'll know from the discussions around some of the investment from the OPFCC's office in precept uplift of mental health dedicated officers that are working in partnership out in our communities. So people like Margot, who we heard from, who are getting ahead of the crisis in partnership to try and intervene when people have a wobble, and we try and intervene before it reaches the crisis stage. So I can see that type of partnership, collaboration work expanding, because neither do the health service want to deal with people in crisis, because it's very resource intensive and is actually damaging to the individual who ends up in crisis, rather than the intervention being ahead of that crisis occurring. So I do think there's still more to do on that.
Okay, thank you very much.
So what's stopping us from progressing some of those things? As we've already talked about, the resource challenges across the public service, there are lots of examples, I would suggest, of public services other than policing where there are higher demands on those services than the services that are available to the community. And of course, we each have our core responsibilities. And we perhaps should have put a diagram on here, but we didn't. But it's best described by the Venn diagram of we all have overlapping circles as partners, but each of us has that unique bit of our circle that is the core statutory responsibility of that agency. So policing, obviously, our law enforcement responsibilities and our warranted powers. For our fire and rescue service colleagues, obviously the firefighting element of your job. And it's true of all of our public services. So the thing that sometimes challenges those collaborations growing, which is the expansion of the partnership, prevention, early intervention in the middle of that overlap, is the pressures on each of those unique responsibilities of those individual services. So that's a challenge for all of us.
Just for policing, given things like the national uplift and locally increases in the precepts, who have more officers effectively and more other staff as well, but do you see that giving you any sort of wiggle room in the longer term to help ease that pressure?
So,
or is it just sort of going back to where we were, 8 years,
So I think when you look at performance and evaluation, there's been quite a lot in the media about the number of incidents that we attend, the way in which we assess. We're very lucky in North Yorkshire that we are one of the safest places in the country. And when you look at our percentage attendance in comparison with some of our more metropolitan forces, that we do still physically attend a high percentage of incidents in comparison with some other forces who are perhaps under more pressure from the volume of work. But as you'll have seen nationally, the concern around the huge drop in people being charged or prosecuted for offences or detections. So I think the slice of our Venn diagram is, are we delivering an exceptional service as a police service in the bit of the Venn diagram that is uniquely a police responsibility? And the answer is no, when you look at some of the performance stats that are out there nationally. So I think, for me, the uplift in officers and the criminal justice support that has been talked about that will come with it is us then delivering a more exemplary service in the bit that is our responsibility. Yes. And I think until we can do that, it's then the challenge will still be the expanding out into the... I think they need to run in parallel, because the demand will continue to grow in that slice of our Venn diagram unless we invest in prevention and early intervention to prevent people coming to harm in the first place. So it's a really difficult balancing act to get those two things to run side by side. And that moves on to the second point about strategic and tactical level buy-in, because we have each got our service delivery plans as agencies, and therefore the focus will be on the performance and evaluation of the delivery of that service. I'm not quite sure we have got the opportunity to evaluate fully the benefit to each of those public services of the joint working on prevention and early intervention that sits at the heart of that diagram. Because if we could prove through evaluation the reduction in demand on the bit that is exceptionally your job, the investment would be more visible and more compelling to those agencies. And I think this is not a criticism, I think we absolutely understand those pressures, but it's how you evaluate, and it's normally long-term outcomes and benefits. It's how do you get the buy-in of spending some of the budget on those early intervention, prevention, partnership working initiatives, and prove that they are the things that have reduced the reactive demand that sits with each of those agencies. So I think that's a challenge. Digital compatibility across partnerships. We have digital challenge across policing. let alone across some of our partner agencies. So all of our police forces have different computer systems. Our own computer systems don't sometimes talk to each other, let alone nationally. So there's a whole digital programme going on nationally and across the criminal justice service. But again, that's about then the local digital challenges of, and we've talked about ORCUMA already, about some of the challenges of, even though we've got a platform, the effective and consistent use of that platform is also a challenge for us. So I think there's some of the things that, at least these things are visible to us, but it's how do we put in place the things that will unblock some of those challenges so that we can move forward.
Yeah, and it's hard with having sat on a digital policing portfolio board, the challenges of working at a national level, so the digital evidence type issues that effectively spent a lot of time and money nationally to get very little distance of change, and then it's sort of just being wrapped up as a programme is just sort of highlights the challenge of it all, and that you can't do it on your own at all. So if you're working with criminal justice, for example, MOJ in courts and others, and it is difficult, to say the least.
So there's some of the challenges to overcome, but at least we're aware of them.
Yeah.
And there are pockets of work to try and overcome some of those. So, for example, the integration co-location with other agencies in buildings is going to help us with the digital challenge, because if we're physically working side by side with each other in offices, the digital gap is not so big, is it, if we can share systems that are physically sitting in the same room that we're sitting in. We've had examples of that in the past with probation service and prolific offender programmes where we've sat together. Therefore, the digital challenge is not how do we share that information, because you can use each other's computer systems. So this just moves on to some of the stuff we've just been talking about in terms of how do we overcome those challenges and the opportunities. We're not good at measuring outcomes, as we've discussed many times, so I think us having a more transparent performance framework of what does an outcome look like and how do we measure it, and how do we therefore use that evidence with partners to say you could massively reduce your reactive demand in this area of business because we can show the impact that it has by working in partnership to prevent people coming into that public service need in the first place. The co-location we've already just touched upon, but it's more than co-location, it's about actual integration of working arrangements. We've all seen collaboration initiatives where people physically sit in the same building, but they could be 10 miles apart, the working arrangements feel the same. So it is about that integrated working and sharing of information. Shared intelligence and community safety, as you can see that there are a wealth of staff working across public services that come into contact with and see and hear things every day. And it's sometimes referred to as soft intelligence. So we've got people working in local authorities that go to people's houses all of the time and sometimes pick up on some of those things that we could support as a public service in that household, but you wouldn't expect the person, for example, servicing the gas fire in the house in that community, wouldn't necessarily see it as part of their job to think, you know, actually, there's an isolated elderly person that's a hoarder that's got all their, you know, you can barely get into their house. That is something that a multi-agency partnership approach could resolve, but it wouldn't naturally sit with that person to report it. So there's a real opportunity for us working amongst those community safety environments where we can share that intelligence and information and actually react to something we wouldn't normally know about. I think when we work more closely together, we can make decisions more speedily. So there are great examples of this. Again, for example, in some of the community safety hubs, where it's obvious that each agency is dealing with the same individual or community issue. The fact that they are all sitting together, it can be allocated to a lead person, and that problem-solving plan can be put into place and implemented much more quickly as a result of those people working together than if we then remotely shared that information with housing or health or somebody else and it gets picked up as separate agencies dealing with it. So having that shared arrangement of tasking meetings all together rather than separately speeds up the implementation of some of the problem solving that we can put into place. So there are things already in place that would help, but as we've said, there's still more work that we could do. So what can we do about it, given we're aware of all of these things? So here are the things that, looking forwards, we're looking to develop. We've had a great introduction just 2 weeks ago now, or 1 week ago, wasn't it, on Monday, with our public safety service officers. So we're starting to see the tangible outcomes of some of that working together. It's a huge thank you to some people around this table that have worked very hard on that initiative to physically see our brand new public safety service staff in their uniforms here, receiving their training across the agencies, and it'll be lovely to see them out physically in the community. So we're overcoming some of those things that we've just talked about. We've already talked about ORCUMA, and obviously we need to develop the consistent use of that across partners. Leadership and enabling services, we have a collaboration physically in the room with the shared enabling services across fire and rescue service and police. Again, that is in its inception phase. We will have a full heads of function management team in place by the 1st of April that will be a truly shared management team across the two agencies. So that then needs to be embedded and developed from its inception. We've got, sorry.
So I'm imagining this sort of meeting could be had in the NHS or in another fire service or another police service somewhere else. Apart from the fire service and policing, in this context, working really closely together, having shared services and shared leadership structures. What do you do with leaders in other agencies to overcome some of these difficult decisions? So tactical level, it's community safety hubs, and it's working together and it's working through problems. At a strategic level, how are you trying to get your Venn diagram in a more understood or better evidence, whatever it is? How are you sort of having those discussions?
So there are a number of forums that are starting, and some of them have been around for a little while actually, where at a strategic level agencies are getting together. So in the past, and I know that they're looking to be developed, we have tri-service meetings with ambulance, fire and police in terms at a strategic level to say what could we do more together that we can then share and be delivered at a tactical level, but there's got to be the strategic buy-in and direction of travel. Training opportunities, again, we've had strategic conversations about some of the command training that we all do. So Jessup's a great example of where people already come together at a strategic level, say with local strategic partnerships where we train together for critical incidents and operational emergencies.
Safeguarding boards, they put on joint training as well around adults and children vulnerability areas.
Health and wellbeing boards have development days at a strategic level for a variety of agencies. So there are already quite a lot of forums that exist that we attend as a strategic leadership level, where there is a consistent buy-in to the shared vision of the direction of public service and community safety. And so that work is going on already across North Yorkshire in those forums.
And are they effective, or is it? I know it's because these things can be intangible. There can be lots of discussions and not much action sometimes. Are you getting a sense that there are genuine sort of genuine progress towards us? 5 years' time, we will work in these ways differently or more together?
I think they are already. I think you start to look at the multi-agency safeguarding teams and the screening hubs, the vulnerable assessment teams that work closely together, the MARAC around the domestic violence and violent offenders areas of business for us. All of these teams are coming together, not just from the training perspective, but they're taking that and bringing that into the multi-agency approach they're taking to safeguarding, threat assessments, delivering services on the ground. So I think all of that comes out operationally as well. And again, all these locations, if they're not multi-agency meetings, they're also jointly located teams. So Community Safety Hub was one example. You've then got the MAST team, the multi-agency screening teams are multi-agency. So again, these are areas of business that are already working well in integrated partnerships. I think some of the work we're doing is now to take that to the next level and the next generation, and that's where you see the Craven pilot going on, where we're looking at actually how do all these services come together to provide that early intervention and prevention services in our communities, more co-located in those communities, place-based services. So some of the partnership work we'll be doing now, multi-agency wise, has been located within those multi-agency buildings, and they're really fantastic. The next step is to take those into place-based locations and do exactly the same, but directly connected to the communities.
I think just to build on that, there is also, for us, as part of when we're looking for example, in counter-terrorism, for us, looking at physical barriers, for example, in places like York or Scarborough, the police don't have the money, but we have used that influence to get the City of York Council, for example. They've got vehicle mitigation as part of their long-term city plan. In Scarborough, they put vehicle mitigation in around the arena, so the outdoor theatre. So we are influencing, and a lot of it is around influence, and we're in there, and it's beginning to change. But as the Chief said, the other agencies have their own priorities. So a lot of it is long-term, getting in there, building relationships and networking. Are we doing that? I think we're doing that at all sorts of levels across the organisation.
And then, whilst I know the answers for the public's benefit, that's North Yorkshire focus on how we can work together with all our partners in North Yorkshire. What's the police-to-police collaboration picture for as big as you want to go, from local to regional, wider?
Well, obviously there are national initiatives from a police-to-police collaboration perspective being developed. So there's a procurement stroke business, I'm trying to think of the actual acronym of it now, but basically a business unit type model of national opportunities for forces to come together when they procure services. So rather than doing it separately or regionally, there are some national opportunities. There are discussions about some of those national elements of policing that could be delivered more effectively through a national framework rather than individual forces undertaking that action. There are, of course, a plethora of National Police Chief Council portfolios that consist of national boards and regional structures that sit underneath them, have an opportunity to share frameworks and best practice across policing. So individual forces are not doing things on their own, that there are some regional arrangements. So one discussion, for example, for us in Yorkshire and the Humber is we do firearms training with our counterparts in the region. So there are opportunities for us across policing, both nationally and in a regional structure, and we have something set up for 7 forces of the North East region, where we are running a cybercrime rollout of some of the national initiatives that are available, but also looking at business crime and opportunities to train together, which has been put together as a package for the North East region rather than us individually training. So there are opportunities both at regional and national level for us to collaborate with police-to-police collaborations.
And are they ambitious? Going back to the sort of police and crime plan. And don't get me wrong, so I know police-to-police collaboration can be amazing, it can also be very difficult and everything in between. And the more ambitious you are, the harder it can potentially be. And there's a trade-off there, isn't there? But just whether you think it's at the right level or it's too ambitious, not ambitious enough.
I think that some of the work that's starting to progress is aiming to be more ambitious than we previously have been. If you think about police-to-police collaboration, it's been around for quite a long time now, probably 15, 20 years. And if you actually then say, so what have the outcomes been of that police collaboration? And in some cases, the collaboration doesn't exist anymore. The collaboration might have been quite basic in terms of the sharing of operation, network structure of almost all that's changed is the line management structure that sits over which is not ambitious, it is cost effective, but not necessarily an ambitious collaboration. I think that the direction of travel is much more ambitious.
I think probably as well to slightly change the word, at the risk of changing the police and crime, it's the ambition of our collaboration in North Yorkshire Police is the key thing for us as well. So it's understanding what's the strategic requirement for us to collaborate and how we're going to benefit our communities in North Yorkshire. So there's collaboration for collaboration's sake, or actually there's meaning behind what we're looking to do. And I think when we talk about ambitious collaboration, it's got to be tied to the ambition that our collaboration is seeking to achieve for our community. And I think that's where we are starting to look more in a smarter way at what we're looking to do.
Okay. Thank you very much.
We won't have a whole debate about the definition of ambition.
I know.
Or ambitions.
No. And it's hard because we just talked about things like the digital evidence program with the MOJ, which is a really ambitious program that didn't achieve very much because it was hard to do. And so there is a trade-off there.
We've already talked, so evidence-based policing steering group, public health approach. So the vast majority of what people think about the slice of policing and its core responsibilities is about reacting to symptoms in society. The public health approach to policing is about us then considering, so how do you get upstream of some of those things happening, and that isn't on our own as a police service, because as we've already said, there are lots of other agencies who are involved in the way communities develop, quality of life, the life chances of people. I know at these meetings before we talked about adverse childhood experiences that are often in the hands of other agencies to influence. So how do we create a position where we prevent people coming to harm and ending up in a situation where they require a police response in the first place? So there's a whole body of work around best practice and how you prevent somebody entering into the dependency or, if you like, on public services in the first place.
And it's also helpful to know what doesn't work. So Julie was saying the other day, not sure at this meeting, but there was quite a lot of evidence, officers going into schools to say don't do drugs doesn't do an awful lot of good really, and there might be a better way to go about doing it.
Assets and estates we've already talked about. I don't know if we want to go into that in any greater detail, but it is about the working together rather than just sharing a building. Putting the public at the centre, we've already given an example of when you problem solve rather than doing it as separate agencies. The problem solving plan puts the person at the centre or at the heart of the problem solving plan, and it doesn't matter who the lead agency is because all of the other agencies are bought into the shared overarching outcome for the individual or place or hotspot issue that's sitting at the centre of that problem solving plan. And we've already talked about prevention and early intervention. Once somebody is touched by the criminal justice system or becomes a victim in any way, yes, we want to deliver an exemplary service, but their lives changed forever. And you can't ever go backwards and change that for that person. So the focus on preventing that person ever coming to harm or ever having to end up in a situation where they're in trouble with the criminal justice system is the preferred outcome for all agencies, because the cost to all public service is much higher if that person enters into that lifestyle. So there are benefits across agencies rather than just in terms of policing and delivery of a policing service. So that's the direction of travel.
I'll give you 2 minutes. I'm not going to interrupt, so you've got 2 minutes.
And 2 minutes to say, so what's it going to deliver? And what we're going to do in the next 12 months. As you can see on some of these, I won't go into great detail unless you want to product specific areas.
I can't. Tom can. I can't.
Tom can.
The next slide, I can't.
Obviously, problem solving is a real key to the prevention and early intervention element, and all of our staff need to. This is about people being curious at everything they go to. So the response officer goes to a job and they deal with the actual thing they're reacting to, but also takes note of how do you stop someone being a repeat victim of that thing, or how do you prevent some other issue happening in their life. So it might not be on their job title, but if every single person in the organisation, and this relates to enabling services also, so somebody in an enabling service where something's gone wrong, how do they not just problem solve the thing that's already gone wrong, but prevent any further things going wrong in the future, I suppose. We've got work going on with the estate strategy to look at co-location with other agencies. I won't go into that in any more detail. We've already talked about mental health coordinators that we've invested in. So we're investing in resources that are about prevention, early intervention, victim support, all of those things that support people to feel less vulnerable in society. Early help and adverse childhood experiences we've already talked about. It isn't something that the police can deal with on their own. It has to involve all sorts of agencies that are involved in parenting and early life circumstances that can prevent people coming into contact with public services later on in their life. In terms of criminal justice process, the two-way interface, so TWIF, between North Yorkshire Police, well, all police forces actually, and the Crown Prosecution Service, which is a digital solution but also about a relationship. our engagement across the criminal justice service. So Mark touched very briefly on Trinity. So this is about rehabilitation, working with people like the probation service, so that we put a holistic programme around people to prevent them from reoffending. And the public safety officers, if you think about the rurality of some of the work in North Yorkshire, there's a real benefit to delivering a joined up service out in those rural communities with individuals who've got multi-agency skills rather than just one skill, and sending a separate resource out to that community from a different agency in 3 separate vehicles to see the same person. So there's much more, I think, that can be done with that.
Thank you very much. Appreciate that. Thank you very much. John, over to you.
Thank you. Okay, so ambitious collaboration for fire and rescue services. Just to give a reminder to listeners, this is one of our priorities, which is set within the fire and rescue plan set by the Commissioner. So we have got caring for the vulnerable, and we delivered on that last month. This month we're going to talk about ambitious collaboration, and then the other 2, realising our potential and effective engagement, will come in the following 2 months. So today we are talking about ambitious collaboration and how that might contribute to helping people be safe and feel safe within North Yorkshire. If I can get the clicker to work. Go, right. So I know Liz has already touched on this one from a policing point of view, but I just thought we would broaden this out a little bit more now that we are working together through the Enable. And what this brings along a huge amount of benefits with our both services, and certainly for fire, where we've had our challenges with our balancing our budget. Particularly for us, it's been a real help to try and move us forward to become more efficient and effective. So we are now located in one building here at Albert Court for the headquarters, and that now brings along, as Lisa's already mentioned, not just people sat working in the same building, but integrating them, people getting closer together. So sections are actually sat side by side now and working more closely, and that will evolve and develop over time, which again will bring efficiencies and more effective ways of working to both police and fire.
How have they settled in, John?
Very well, I would say. People enjoy it here. It's a nice building. It's a happy environment. I think.
And the company.
And of course our partners in the police are very accommodating. So no,
cake is good.
We have been made to feel very welcome, but staff are feeling and getting settled in. I have to say, in the sort of 6 months, year beforehand, where this was sort of gathering momentum, there was a lot of angst and caution within our colleagues in fire. But no, I think people are settling down now, and I think over the next 12 months we'll certainly start to reap the real benefits of that. It's not without its challenges, which we'll talk a little bit further on about, but in general, no, things are working well. And as a result, new structures are now developing. So we have, as already been mentioned, we've got a senior leadership team now being developed. We've got 5 new heads of function appointed. That new structure will come into being from April, and that presents again great opportunities for fire to really shape up and improve on the way that we work. And again create more effective services, which ultimately will lead to better services for the public. It will lead to more unified strategies. So again, estates is a really good one to talk about, whereby the broadening out of shared estates across the 2 services will continue. We've got a number of stations now, Ripon, Boroughbridge and Beedale, which are co-located, both police and fire on there. We've got others in the pipeline, Labour, Bentham, and an office at Harrogate, which are coming online as well. We've got the transport and logistics hub, where we've got both police and fire all both working together. So that, in terms of a collaboration, that's a real success, developing all the time, and is certainly going to be building on our effectiveness going forward. So broadening it out into our wider partners, we have a lot of things going on with our inter-services. So a good example to use that we've got a joint a collaboration working with Cornwall Fire and Rescue Service for our control room. And what this does, people may think, well, you know, why not a service that's next door to North Yorkshire? The reason we've got with Cornwall at the other end of the country is so that when we've got spate weather conditions like we've recently experienced with the storms, hopefully and generally, if we've got a storm happening in North Yorkshire, generally it won't be happening in Cornwall, and therefore it helps with that capacity. A recent example with Storm Ciara, we had 190 calls within 24 hours, which is exceptional for ourselves, and a proportion of those calls were overflowed into Cornwall to help with the resilience there. And that's the true benefit of that collaboration. Of course, it brings its challenges, but we work very closely with them to do joint training online and other ways. So that is a real good success. It's working very well, and we want to continue with that approach.
In those circumstances, is it still that they can take the call, but the resource actually has to be deployed locally? Because I know that previously they could take the call, but actually to release the resource and send it out to the incident, that still had to be done here. Is that still the case, or is there new ways of working?
That's still the case at the moment, but that's developing all the time as well. And when we're going to storm conditions and spate conditions like we've done, we set up bronze hubs as well. But the point is that the public are receiving someone taking that call and the details that we arrange, and that eases the burden, certainly when it gets to difficult times like we've just experienced.
I think the important point there is that they're prioritising those calls, so that when they do come to dispatch at our end, that we can get the help to those people that need it the most quickest.
Broadening it out a little bit more into the other services, so we do collaborate effectively with what we call the Yorkshire and Humber region. So it's Humberside Fire and Rescue Service, South Yorkshire, West Yorkshire and North Yorkshire combined into the Yorkshire region. And there's a great deal of work goes on there covering the four tools, if you like: prevention, protection, response and resilience. Examples there of work that's been done to improve our service delivery is an example being standardisation of incident command packs. These are things that are carried on fire engines, so that when the crews get to an incident and the incident starts to develop and escalate, there are command packs there which give the officer in charge certain prompts and things that they must do to manage that incident. And of course, as the incident grows and develops, there is handovers at certain times, and certainly when we've got incidents which are cross-border, where we've got appliances from two counties there, the valuable asset now of having a standardised command pack across the services there means that it's very easy to hand over at the end. The decision logs are all dealt with in a consistent manner across the piece. So there's an example of how we have standardised the command packs. Beyond there, we are moving into looking at a standardised approach and a shared approach dealing with our command vehicles. These things don't get used very often, but are very valuable when we do need them, and they're very expensive. So rather than all four services spending hundreds of thousands of pounds on a vehicle, which in North Yorkshire might get used less than 10 times a year, it makes sense to share resources across the region and rationalise our fleet in that respect. Notwithstanding that when we do get incidents, we still need to be able to operate effectively, but we're looking at different styles of vehicles, different sizes of vehicles, standardisation of the software, which itself can be very expensive, which is on these vehicles, and so that again that would create efficiencies across all four services and make us more effective. And then of course we've also got the fallback for the national resilience assets should we need to for command. So there's a number of things there which really do improve our effectiveness through collaboration with our
I've asked this
regional
question
partners.
before, John, but I'm
Yeah.
going to ask again. Given floods and the like that are going on, and not all your equipment is for weather-related incidents, but for those that are, whereas it might be maybe you need 3 across Yorkshire because you need them for this thing this often, is that being sort of assessed on a continual basis now? These once-in-a-generation storms are happening more than once in a generation, for example?
Yeah, certainly it's that sort of thing we've got to build in and factor into these styles of vehicles. Interestingly though, certainly within North Yorkshire, other than when we get large-scale flooding, say perhaps in York, the command vehicles don't really come into their own at those style events because we set up hubs, in different places. But they're very useful when we get large-scale moor fires, such as that. So, they've got a place in different aspects. So we wouldn't necessarily deploy a command vehicle under a flood situation. We would probably tend to converge onto a gold command room either up here or at York and deal with it in such a different way.
So, I've seen some of the work that we've done around that. And reflecting on some of the examples of regional collaboration that the police have been involved with, where we saw kind of resources being dragged into busier service areas. Obviously, the number of incidents West Yorkshire requires a command vehicle are considerably higher than, luckily, than one is required here. If our resources is going to be based near the West Yorkshire border, potentially, is there some guarantee that it's going to be there when we actually do need it, and that they're actually going to be able to respond to our incidents as well, rather than constantly being involved down in West Yorkshire instead?
Yes, so it's not about West Yorkshire getting the big shiny toys, it's about having the right vehicles in the right places. So what we're looking at is some smaller van-based vehicles, as well as the larger vehicles, and then you've got a blend of the two should we need them. So a van-based style command vehicle will still be as effective, and that's probably more suited to what our needs are within North Yorkshire.
Okay.
But should we need it for a larger scale incident, we can call upon the region to come and help us out, and it will be on they will deliver it to us and drop it off. But I also mentioned there about the NRAT arrangements as vehicles called enhanced logistical support vehicles within national resilience that we can call upon to support should we need it. So there is the support beyond and above what we do regionally. So there are contingencies for that. There is situation built in there. Training's another area where we do a great deal. So we've got arrangements in place where fire investigation officers are shared across the region. Certainly when we get fire fatalities, we then draw on our regional partners to support us, and indeed we go into across the border with reciprocal arrangements there. And so all of those style training scenarios need to be planned on a regional basis. We do an awful lot with our regional partners on the preparedness for terrorist activity. And there's a great deal of work goes in there behind the scenes on our preparedness, building on the capabilities that other services have got available to them. Moving away from fire into other agencies, Yorkshire Ambulance Service, we've got an agreement with them whereby we, at 2 of our stations, Lythe and Pickering, we respond to what we call under an agreement called emergency first responder, and that's where we've got on-call staff where we've got a surplus, shall we say. One of those will become available to respond with blue lights on the car to cardiac arrest and low scale and other medical events. We respond to help out our ambulance colleagues with transportation and movement of bariatric patients, and we also go and help gaining access into buildings. So we've got agreements and processes in place now where YAS can call us to go and help out in those situations. I won't touch on the multi-service officer role because James is going to talk a little bit more about that shortly.
Can I just ask, and just reflecting Will's earlier question to the police, in terms of the ambition of those kind of collaborations, especially with health, I know there can sometimes be some difficulties around that, but at the moment there's 2 stations. What's the ambition about where that potentially should be? Because there's great, as you say, there's a great opportunity there to provide a far better service to the public.
So it's twofold really, and again it goes back to some of the things Lisa said earlier. So we've got an ambition that we would like to expand that. I'll come on to some of the challenges shortly, but one of the challenges is broadening of the role, and so it does creep into certain areas where some of the national challenges we've got on pay and conditions, but similarly it's where the need is for Yorkshire ambulance service as well. So it's okay, I was saying we would like to do, but unless there's a need on the ambulance service side, it comes at a cost to the ambulance service, so they've got to make sure that they use our resources where they actually need them, where they're going to be effective. So it's a two-way process, but the intent is to continue and develop that the best we can. We touched earlier a little bit about our involvement both within the police and the fire within the local resilience forum, and again we're very active members within fire, and that itself brings forward collaboration opportunities. So again the recent flooding and storms that we've had to contend with behind the scenes, there's been a huge amount of collaborative work going on with all agencies, and many phone calls taking place, tactical coordination groups and strategic coordination groups on a regular basis, and indeed today there's been flood teleconferences left, right and centre. So it's still happening, it goes on behind the scenes. A lot of the public don't perhaps see this, but we are actively involved with all of those style groups. Coming to the prevention activities and opportunities, we've got active participants within some of the large-scale and strategic groups that Lisa mentioned earlier. So there's the North Yorkshire Community Safety Partnership. Yesterday, Mark mentioned there was a meeting to discuss how we can improve and develop the community safety hubs. So fire were involved in that one as well. And I think it's been involved at those groups at a strategic level and at all other levels that then drives forward the opportunities. I myself have taken on the lead of 95 Alive Road Safety Group for the steering group, and we're also connecting in at all other levels there. Again, we'll talk about some challenges there perhaps later on, but there's also opportunities which we need to tap into. So I think in terms of prevention at a strategic level, it's about being tapped into and trying to push forward with as much as we can do, but notwithstanding that each organisation has got its core duties to focus on, and that itself can be shall we say, not a barrier, but that becomes very much a focus when you've got limited resources. So there's a range of activity that we've got there going on there. The data is another one, whereby we need to share intelligence and data. Again, comes with a whole range of challenges, but we've got opportunities there as well to develop that and get a richer picture on the information, so that we can direct our services to the vulnerable. I'll move on now to the next slide, which is a tactical example. So I'm going to hand over to my colleague James now, just to talk a little bit more in detail about the public safety officer role.
Just like James and John, 20 minutes or so left.
Yep.
Okay, great, thank you. So really just to let people know who I am, first of all. So I'm the group manager for Harrogate and Craven, so I'm accountable and responsible for everything with regards to fire in those areas. And I'm really pleased to be able to provide you with an update regarding the public safety officers. So for those people who don't know, very broadly the concept is individuals being embedded within communities, and it's not constrained to, but at the moment we're looking at them being spread across dual functions of police, fire and ambulance. And their role primarily will be prevention and early intervention within communities, and to use that broader tool set across each of the organisations that are available to them to identify vulnerability, but also take early intervention. So we've already mentioned that as services we all come into contact with the same people quite often. And what we do is we do our bit and we pass it on to the next organisation and so on. What this role aims to do is keep hold of that case. There are going to be times where specialists are needed and we need to refer on. However, that is the point, and it means that we can have a whole-time resource in locations by sharing that resource where previously we may not well have done. But we'll go a bit more into detail about the role as we move on. But this is a concept that has been used across the UK in various different locations, but most successfully in Cornwall, where we visited and taken some of the best practice from there. And on the back of that, the OPFCC have provided the funding for a 12-month trial for 2 posts within the Craven area. And I'm pleased to say that we have 2 successful candidates who started and were inducted last week. They are very capable individuals that went through a very robust process. And the benefits are that we've got one that's got a fire background and one that's got a policing background. So there's a lot that we can learn from both sides there. Now, they are currently undergoing training for their other disciplines as we speak. We're looking to put them live out into the community on the 1st of April. That training will be completed. However, we're not waiting for that. We're already engaging with those communities and setting expectation of how they're going to operate within that. So when they hit the ground, it should be fully supported and it should be gathering pace straight away. What would be good to mention is all the work that has taken place to get them to this stage from the various different departments and some of the challenges that that's presented. Things like IT solutions we've already touched upon, contractual arrangements again across 3 different organisations has presented us with challenges, but we've got to this point and it's a success story to now, but now some of the more challenging work starts as well in making sure that these people are integrated properly within the community. If we can click onto the next slide, please, John.
I don't know if this is the right time to ask, James, but in terms of ambition,
yes,
how big should the trial prove successful? And we maybe won't get into the detail of that, but where could this go? How could it sort of progress in the future to sort of hit that ambitious target?
Yes, so the ambition is that we have these in all areas across North Yorkshire and the City of York. We've already very briefly touched on some of the benefits there, that this is a shared resource, and we talked about, again, some of the issues that we have on a day-to-day basis about sharing data, identifying vulnerability, and so on and so forth. So if you've got an individual who would have been there who previously wouldn't have been and can look across that spectrum and take that early intervention, and we'll talk a little bit about that early intervention, the prevention, so what we've already talked about, trying to move the curve and the demand on public services. So therefore, providing everything goes as we would hope it goes, it will give us the evidence to roll this out wider. Obviously, it's going to give us some challenges with regards to where we get funding, etc. But we will, I'll touch on that as I move through.
Just on that one as well. Well, we started off with this as an initiative called Tri-Service, so that was going to be police, fire and ambulance, and then we fast realised that actually there's a whole range of other partners out there who may like to come on board, and we can then develop skills to deliver other services as well. So hence it's now called Public Safety Officer role, and it will be very much about delivery of a range of different public services according to which other partners come on, and that will be dependent upon areas and the risk profiles within those areas as well. So the ambition would be, yes, to have a whole range of these out there and delivering the best service to the public by one person going.
Thank you. The just up on the screen there, the two successful candidates, Craig and Lucy. Craig was from fire and Lucy was from police. And obviously a brand new uniform, and that hopefully we'll see more of in future years. But just to put faces to names, really, and to see a physical sort of product of the work that's gone on.
They look very keen.
Yeah, they are, and I think that's a testament to the process that we knew that it needed the right people. And what is important to say is that across each of the services, the standards that have been applied have been the most thorough for whatever service that might be. So whether that's fitness testing, we went to the top standards because fire was that. Whether it's health and safety, you name it, we've gone to that top level to ensure that the processes that these people will be operating under are robust.
So a crack team then?
Absolutely. So if we could move back to that other slide, John, for a moment, if we could. And just building on that concept, for the reason I talked about, some of the challenges that we've presented, fire will be the employer because of some of the protection measures in their contracts and that sort of thing. Of obviously, it's the dangers that they will be put in as part of the role, and pensions is another thing. Some of the lessons that we learned from Cornwall has been applied there. So the line management responsibility will be with fire. However,
is that with you then, Joe?
Ultimately, yes. One of my station managers and myself, obviously, is ultimately accountable for the area, and I'll be taking close monitoring of this, particularly in the first few months, because one, we need to make sure they're supported, but secondly, that they're given a steer. You know, at the minute, we don't want to just chuck them out there. We've got to make sure we're shaping this so we get the best outcome for when we do roll it out, hopefully, across the rest of North Yorkshire and York, that we get the best possible outcome and it works. And there will be milestones put in place as part of that, but I'll come on to that. We're not far away. As far as tasking goes, some of their work will be generated from the Community Safety Hub. Neighbourhood policing team will play a key role. And also, as they become more embedded within those communities, it will be self-generating because they will be building networks, identifying vulnerability, and generating that work. So we'll see where that goes. As far as we touched on, it's covering tri-service at the moment, but it's not restricted to that. But at the moment, that's where we are. So just to give some examples, there's two strands to that. There's prevention. So as far from a police point of view, so I'm told, they can correct me if I'm wrong, some of the things that will be around early intervention with antisocial behaviour, but also touching on these ACEs, this prevention element, of moving that curve, of getting in. We know that there's certain people or youngsters that are exposed to certain events or repeatedly in a cycle that we know will later present themselves to one or more of our agencies if they continue on that path. So therefore, trying to enter at that initial level to try and cut that off and move the curve and hope that that changes behaviours, which is, as we know, is very difficult. As far as fire go, again, that is we're going to reap the benefits of that, but also we're going to build on our safe and well work that we do and continue to do, the schools work that we do, and then bleeding into the health and well-being improvement side of things. That again, we know that people that become suffer from ill health later on in life is usually a cause of bad practices, living practices and so on and so forth, and therefore they become vulnerable from fire later on because they're not mobile, they become susceptible to crime and so on and so forth. So again, that's the prevention side. As far as response, they will be an on-call firefighter, so they will form the crew of the local station, so they will jump on that fire engine when they are needed in an emergency and go out to a full range of operational incidents. For the ambulance service, they will be community first responders, so that means they will be able to respond to category 1, which is life-threatening type incidents, and they will be in areas where potentially a resource may have been further away. And we know that with those types, category 1 type incidents, that time is of the essence. So the fact that they are there will hopefully save some lives. And then thirdly, as far as the police side of things go, I say, they can correct me if I'm wrong, but there's a conscious decision there because of the demand on the police service. They would be responding a lot if they had a lot of different things that they could go to. And therefore, that's not the purpose of this role. We talked about trying to move that curve and the prevention elements. So they're going to be monitoring what they will respond to. But that will be reined back, certainly to start with, to try and achieve that balance. And then we touched on wider
like James, 10 minutes or so left.
No problem. Wider partnership involvement. The Deputy Chief touched on that a moment ago, but really, if it's not unique to fire, police and ambulance services, certainly there's areas of health and council work and so on and so forth that this could benefit as well. So if there is anybody watching and they like what they're hearing, please get in touch and we can have a conversation. Finally, just to round up, stress that it is a pilot. There is going to be some things that we're going to have to work through. I talked about some close management early on, and again, evaluation. We're going to need to evaluate this, and there are going to be some challenges with trying to measure the outcomes and the impact on the community, as we know. But what we can do, hope to do, is look at how many people we've intervened with, and some of those, we talked about those behaviours that would lead them on in the future to carrying on that type of behaviour, and see where we've intervened, and hope that that's getting us the results that we want.
Very exciting.
And I'm excited about it.
Yeah, it'll be interesting to see how that plays out, and let's hope it's a success. I'm sure it will be. So just moving on to the next slide there, which is challenges and things we're looking to solve. So yeah, as with all trying to improve something, trying to move it forward, you come across the challenges. And one of the challenges we do experience both internally and externally is culture. Different organisations have different cultures. Trying to bring it all together, we then need to form new cultures, and that itself presents problems, and it's about working very closely to overcome barriers and anything else that may come within there. Certainly within our own staff, it's trying to get them to see the benefits of what we're trying to achieve and how that links back to the fire and rescue plan and the priorities within there, but above all, how it links to making the public safer out there, which is ultimately what we're all about. Again, it's been touched on earlier about wider partner involvement. It can be a challenge and it can be very difficult, but the main thing is that we've got to get in there at all different levels and really work at it, and it's about being creative, and it's about making sure that we are represented on every opportunity we can do to improve. Data sharing.
So just on the wider partner involvement there, obviously there are a couple of things that cropped up in the HMI, the CFRS report around ability to collaborate, especially on operational and tactical level with partner forces. You talked about a bit about opportunities earlier around more strategic level command vehicles and also the Cornwall collaboration. Are there any other plans in terms of thinking ambitiously about local fire service collaboration around training to improve the way that you train together, or using the interoperability principles around other more operational tactical things that you could develop that in response to that kind of
absolutely there's a range of different opportunities. One of the opportunities that at the moment we focus very much about working within the Yorkshire region. And yet we've still got we're surrounded by 7 different fire and rescue services in North Yorkshire, so there's an opportunity to branch out further and go more north as well, and tap into resources available there to ourselves and try and improve there. Certainly the training side of things we are very much keyed into within the region, but there is more we could do. But it comes with its challenges as well. So you know, when we look at our resilience and our ability to respond to incidents using our officer cadre, we do constantly look to see if there's something we can do regionally on that. But of course, North Yorkshire being the geographical area that it is, it becomes sort of quite difficult, and what we can't do is be seen to shrink our organisation and expect others to cover it for us without some sort of reasonable financial arrangements in place. So there's a whole range of issues there which we've got to overcome, but nonetheless there are opportunities there as well. Information sharing is a real difficult one. Data sharing, you know, it comes up in all areas. We are actively working to try and get data sharing agreements in place with a range of different partners. It is a challenge, it really is a difficulty to try and get people to see that there is benefit within this and to take a little bit more risk on that matter, but that's something which we continue to try and improve upon. I think data is key to a lot of our problems in terms of where we direct our resources. Certainly, again, it's something that's been recognised nationally that the fire and rescue services on a whole must improve their data. Conditions of service, I touched on that one earlier, that can present ourselves with problems when we're trying to broaden out into other areas of prevention. There is a national pay debate going on at the moment, and so this is really about understanding the differences, understanding and respecting the boundaries, but working alongside, because there is still work that we can do in amongst the national pay debates that are going on. We can do things locally, and so we've got to keep going at that and develop good relations with rep bodies to actually move that forward, which we are doing well at the moment, but you know, we need really to keep working at that. National influences, so you know, we do get national drivers which prohibit or might influence us to go different ways. So for example, we had an opportunity recently regionally to enter into a personal protective equipment procurement process. We opted out of that one because we didn't have really the resources to add into it, and also nationally there's a drive to fire and rescue services which should be adopting a national framework which has now just come out. So that's the route we've gone on it. I think it'll be more cost effective for us, but it felt strange when we ought to have been supporting our regional colleagues on it, and it's a fine line to decide which way to go, and it takes a lot to work out where the resources and the finances are best spent. And it just leads on to the resources and budgets. You know, each of the different organisations which we do want to and try and collaborate with have obviously got their own core responsibilities and resources, limited resources, and you know, for us to put together projects, for example, what the one that James just talked about, it takes a huge amount of resource to get things like that kick-started, to get them off the ground in the first place, and we're not rich with resource at the moment, so it does create ourselves challenges.
Got about a minute slide now, John, give or
Okay,
take.
yeah, that's fine. So opportunities, well, Andrew's set his ambition 2025, on-call availability is one of the ambitions to improve, and that overall will improve our effectiveness. So there's the ambition 2025, and there's many things within there which will lead into collaboration opportunities, which we need to get going with. As I've said previously, raising awareness of our capability within our partners by getting more actively involved with some of the groups available. Data sharing, already mentioned that one. We need to get agreements in place, but keep at it and not back off. Regular dialogue with staff representatives to overcome our challenges there. Involvement in local and national working groups. So we are becoming more involved now with the National Fire Chiefs Council, but again that comes back to resource. So we would like to be a lot more involved there, but it takes away from the day job as well. So there's a fine balance there of being able to cope with both. And then really the cross-functional working within departments, that's, you know, very much coming together now with the Enable and just continue on working together strategically, tactically and operationally. I think above all, that smarter ways of working, that we've got to keep looking out for that all the time within the opportunities that we as they come along.
How much, John, is the ambition curtailed by the real challenge around resourcing? So brings with it problems that the extra resources policing is getting, but they're good problems to have to deal with. Yourselves are in a different position where the government have, for some reason, put less focus on and less money toward. How much is that just a real barrier to being able to do some of these things because you don't have the resources to try and test or get involved in national discussions and the like?
It's a real challenge. There's no two ways about it. Well, you know, we would like to, as I say, get involved. You know, the ambitions that Andrew set, on-call review, maximising our service delivery capacity, and looking at our, you know, our investment opportunities. They're huge projects in their own right. We've got an integrated risk management plan, the risk and resource model, which all needs time to resource and plan. But you know, let's not take away from the fact that Enable will help us with that, and the resources now that we've got through two organisations being together. There are some real true benefits there. But it really is a challenge in the resources when we are so lean in terms of resource. So, aims of what we want to do, well, we'll continue raising awareness within both partners and our own staff, the benefits of collaboration, and we'll continue to do that. You know, we're very much keyed in through the Enable side of things now with joint leadership programs. We're involved in the intersectionality conference. So all these are really good for us to draw together and all our resources and get all our colleagues on side and get moving forward with it. We do, you know, through the public safety officer role, the enhanced exposure to community safety services work that will improve, and that is a real aspiration to move things forward. We will continue with our shared estates programs, and we'll continue to work more closely with our partners. I think an area that we do need to look into and identify is more closely the fire to get see what opportunities there are within the voluntary sector, and I know that we learn an awful lot from our police colleagues on that one. So there's some real opportunities there for us to move forward with. And so what do we want to try and achieve in the next 12 months? So again, the continued development of shared support services through Enable, that will, I'm sure, over the next 12 months really get embedded, and we'll start to reap the real benefits of that. We want to deliver safe and well training to our staff, but also wider out to partners. Develop, expand and embed the public safety officer roles. We want to use data more effectively. A range of different data sets out there which, if grouped together, will identify our vulnerability and help us direct our resources more effectively.
You need to get it as well as use it, don't you?
And that's the difficulty, yeah. Develop evaluation tools. It's something we don't do very good at the moment, but we've got a new area manager assurance role coming on song, and that will be very key to his role in helping us develop some evaluation tools. And above all, we want to continue to build on our interoperability with other responders, so that we can become more effective as a fire and rescue service.
Thank you very much.
I don't know if we're on time.
Almost. And I had a couple of questions, but I'll pick them up outside the meeting because they're not urgent ones. Thank you both very much for that. Really appreciate it. We will move swiftly on to performance, which I think police are first again. Charlotte? Give you the joy of...
The button.
I thought it would be slides.
Okay, the first slide is in relation to mental health incidents. So incidents with a mental health flag remains at 12%, which it was for the previous month, of all incidents over this last time period. there was an increase in mental health related incidents in April 2019, but that was due to a change of definition from College of Policing, and we did expect demand around that to flatten off after that time, which it has done. So we are seeing a fairly static volume of mental health incidents on a monthly basis. Just of note, NYP recently took part in a 24-hour data capture around mental health demand, which was sponsored by College of Policing. Interestingly, in relation to the national picture over that 24-hour period, we recorded 20% of the incidents as mental health related, and the national trend was around 10%, so we were quite high up in that, which might be the way that we're capturing the data or recording it, but we were just waiting for that report to come out. The middle table there, I know it's difficult to say, just looks at type of incidents where mental health is a prevalent factor, and the percentage of those incidents with mental health flags. You'll see from there that PSW, concern for safety, and missing person incidents are high in relation to mental health flags. And the issue with that is that those types of incidents do require a significant number of resources on average. So the force average per incident is, for a normal incident, it's 2.3 resources, and for PSW is something like 6.6, so it is significant.
The top chart's not misleading because it's factual, but the number of incidents is one thing, the impact it has on the service is a different thing entirely, isn't it?
Yeah, so I think just one thing for us to bear in mind, I think, in the report coming out from the colleges, when we look at that 20% of incidents, whether that's how we record it or otherwise, I think what we also have to bear in mind is the number of years there's been underinvestment in mental health services in the county versus other areas of the country, and actually whether or not that's had an adverse impact on policing.
Yeah, but we see rural areas generally underfunded from transport to health to policing, etc.
So the bottom table relates to section 136 detentions. There were no detentions in January 2020 where we used custody as a place of safety. That final row there shows that 5 cases were identified in custody, so there were people who were brought in custody for another matter and presented, and it was recognised that they needed to be taken to a health-based place of safety.
So I have questions around this. It's really, this is the second month it's been, and it's great because it's really interesting. It seems to me that, and this could be oversimplification, so apologies if that's the case, that there is either an issue in the arrest, and that the arrest, there could be potential within that arrest to spot mental health distress and crisis, or there is now a clear sort of a theme and risk that the act of arresting someone then deteriorates in their mental health into crisis. But either way, there's an issue then of having people in custody that need mental health support, and if there is effort being put into understanding which of those is the option or both together, and it's random, and how to minimise that, because despite it, they're not being detained and arrested to take to custody, they are still in custody in crisis, which is not where we want people to be. So trying to unpick that and have that bottom row as 0 as well, ideally. I know that that's difficult, but is there work underway to understand this in a bit more depth?
I mean, I'm not so sure you would ever see that row as 0.
No, I'm sure.
So for example, if somebody presents in drink having committed an offence, so that could be drink driving, it could be public order offence, it could be whatever that would be, it could be domestic violence, whatever that is, whilst they're in custody they then sober up, and then it becomes apparent they have a mental health issue as well. So sometimes these things are masked by other things, but the officers at the time have not got the ability to understand that element of it until some of these things work their way through the custody period of time. So I'm not so sure. So I think for me,
I'm not saying
rather than we should see that lower, I think what we need to understand is, are those 5 appropriate in terms of, was it appropriate to detain them for under arrest for other offences, and have we then subsequently identified the mental health, or did we know the mental health was there in the first place and used an arrest to get them into custody when actually there's other means? So I think what we probably need to understand from criminal justice is, are we comfortable from their reviews they're doing of the people arrested in custody who subsequently present that was the right course of action?
Correct. So I don't disagree. We don't know why those numbers are these numbers. And it might be a problem with street triage or advice from a mental health nurse that actually ends up being bad, whatever, through no fault of anyone's, or it's something to do with being in drink or whatever else, but we don't know the answer to that question at the moment.
The other thing is the liaison and diversion thing, is that custody are more likely to identify things that they perhaps wouldn't have done in the past.
Sure.
So that could be...
But again, there's learning there does that mean there is learning and it's a different way to deal with people who are found doing X or Y or have a certain trait in their background or whatever it might be?
I think that's a fairly easy narrative we can add into the report.
Because there are numbers.
And I'm sure people are doing that, it's just I don't know the answer to that question. I've no doubt Richard and others will be doing that. I just don't.
I think there's also...
And what's being done as a result, so it's all, again, well and good doing the review, but what's that changing in terms of...
I think there's also a question that we need to ask of our mental health partners, because places such as secure wards where an individual's there and assaults a member of staff, there are instances where we have not investigated because we have said it's not in the public interest, or they don't have mens rea, the intent. When you speak to mental health professionals, they're saying, no, you should investigate the incident properly, and then the decision about whether they got the mental capacity to commit the crime should come afterwards. So there's a real debate about that, and if you come across someone in the street who's clearly committed a crime, the advice I think from our mental health colleagues might be arrest them for the crime and then bring them into custody, and then we can do an assessment. So it's
they're different
finally
issues, aren't they? That's not presented whilst in custody. But I know that
no. If you arrest someone for a crime and they come into custody,
that's what that bottom line means, that they were arrested for an arrestable offence,
and then
when they got into custody, that's the only way they ended up in custody in the first place, because they were arrested for an offence.
Sure, but there's some occasions where you can deal with things differently, as you try to say, where you might not end up arresting them for whatever reason.
You may, but I think if we're going to go down this line, we need to have the discussion with our mental health colleagues about the professionalism.
And there are occasions where that does take place. There are occasions where somebody is reported for being suspected of committing a crime. Officers will attend and realise there's a mental health issue, so we'll take them for an assessment first. If that person is then subsequently detained, then the crime is dealt with in that manner, that they don't have the mental capacity in relation to that. But these are, I think, probably because of the low numbers, we're trying to problem solve this here today.
Yeah, of course. I don't
mean
mean
it's not there.
Let's do some reviews and give you some information coming back.
That'd be great. And having met people who have been subject to crimes from people in crisis and them not dealt with, probably for good reason, they felt that was unfair to them. So I totally understand that dilemma as well.
Okay.
Okay, so this relates to Section 136 detentions, which continue to reduce for this last month. The issue obviously around 136 detentions is the number of officers and the time it takes to deal with such incidents. So the average number of officers for a normal incident would be around about 2, whereas for a 136 incident it's 6.22. And in terms of time, the average number of hours it takes to deal with such an incident is 14 hours as opposed to 2 hours 20 minutes for a normal incident. So that's the impact that those types of incidents have on us. The second table down just shows the type of incidents where Section 136s mainly occur, which is around concern for safeties and missing persons, which won't be a surprise. And then it just provides a gender and age breakdown around the people involved in that, and some information around the mode of transport. So 66% of those occurrences in January were transported by a police vehicle, and it just shows there the reason, the police vehicles versus the ambulances that were called. The admission rate for Section 136 detentions has reduced from 39 to 39% from a monthly average of 60%. which is quite a dramatic reduction. Any questions on that one?
No, and feel free to go through by exception, Charlotte, if anything
Yeah.
sticks out.
So I think we need to monitor that percentage of detainees resulting in admission, because that's a significant drop, and
It is.
60% is quite a positive amount in terms of how we're identifying, and use of street triage about how we're identifying those actually that are in need of medical intervention in relation to mental health issues. So to drop that down to 39%, I think we probably just need to keep an eye on that and to see how it goes for the next reporting period.
Yeah.
I think we also need to explore whether that is because of the strategic direction of care in the community and the removal of secure.
I think one of the things we would be really interested to understand is whether your officers on the ground actually understand the referral pathways now that there is this new model of crisis care in place. We have a suspicion that, not for their own fault, that they don't necessarily have that really robust understanding of who they call, when they can call them, and how they get somebody in crisis into a supported situation. So that would be something of real interest as well, actually.
And are different decisions being made on the ground because they are aware of changes to, where they can refer people to, and that's either causing confusion or making them go, well, I can't do that.
Yeah.
But I'd agree, Phil. I think that would be
we'll keep
keeping an eye on the percentage rate.
And it might need to be sort of geographic. So, for example, changes in Harrogate and Northallerton. It might be things in York are pretty static, but it's changes in a particular area.
Okay, so this next slide gives an overview of count of incidents for the whole of the force and the number of crimes committed, which you can see on the top left-hand corner. I don't know whether there's anything you want to pick up by exception on there. It does provide days of the week, times of the day, and the highest wards by volume of crime for the force.
Nope.
The next one is the same slide, effectively, but broken down into the command areas. So this one is for City Command, which will include York and Selby. Nothing by exception that I can see there. The next one is for the coast, Scarborough and Rydale, same information. And then finally for County Command, Hambleton, Richmond, Harrogate and Craven.
The only question I've got, which I don't think you'll be able to answer, and I assume the answer is yes anyway, but on all of those, the highest ward is always about twice as busy as the next highest ward, and so there's clear sort of geographic focus in each of those command areas. If that's where response is busiest, do MPT sort of services fall in behind that and that's where the focus of their effort is, or do you have to be careful about having a fairer sort of split of resources across the whole of a command, whether or not?
So when you look at Guildhall Inner, we're looking at, again, you're looking at United Town Economy, you're looking at your retail premises, again, you've got the City Task Force that's focused on that, you've got a City Centre Neighbourhood Policing Team. Castle Ward, again, levels of deprivation for there. I know that their community safety hub is focused on that and working on that collectively with our partners. But I think these are well-known and traditional areas where we expected to see. So there's nothing on there that we weren't expecting in terms of being that higher.
At my point, I suppose a better way of wording my question would have been there's a greater capacity to prevent crime in those areas than there is in the others.
Yes. But so for example, for Guildhall, it might be higher volume but lower harm. So we just need to balance against the threat and harm.
Sure. Yep.
Yeah.
Okay, this next slide looks at comparisons by crime type over the last 3 years. Some of the things to just pick out of this are the significant decreases in some crime types, such as drug offences and vehicle offences, but then conversely significant rises in certain types of crimes, such as miscellaneous crimes, which include public order offences and certain violence type crimes. So if we look at miscellaneous crimes, there's been large increases in forgery type crimes, which is noted. Greater awareness is all I can think to put down to that, but we'd obviously have to look into that a bit further to identify why. And also threat or possession with intent to commit criminal damage has increased significantly. There's been increases in public order offences, particularly public fear, alarm or distress, section 5. violence, assault without injury and malcoms, which links to greater awareness around those types of crimes. And then finally possession of weapon crimes, which we have seen significant increases in, and that's potentially linked to county lines. Year to date, the highest percentage...
Just on some of those offences, I think the other thing we've got to be bearing in mind is because we've done a lot of work around crime data integrity, some of our you'll see a significant drop in some of our antisocial behaviour incidents, but actually some of that as well is where we've reviewed some of those and looking at some of the language that's been used. That's where the threat to commit criminal damage, which may have been previously recorded as antisocial behaviour, or the Section 5 public order, somebody sworn at somebody else. They previously may have been antisocial behaviour. Actually what we're doing is going through those and saying actually they're crimes, so we'll record a crime. So we just need to, I think, balance against the drop in ASB versus the rise in some of these types of crime.
We've done a similar piece of work because the ASB stats have been, on the face of it, really exceptionally good in terms of going down, and so the team have done a piece of work around how much of that was a shift in crime recording and how much is a genuine decrease in antisocial behaviour. We think it's a mixture, but I can't remember.
Yes, and I think some of it is also just unexplained, because even when you look at the changes in recording, it doesn't add up to something at the end of the day. So we had a quick discussion about this a couple of months back, didn't we? But finding a way to actually understand what is still, because the amount of evidence, should we say, coming into our office at least around antisocial behaviour and the levels of antisocial behaviour that the communities are experiencing doesn't seem to have changed, and it's new people bringing that evidence in. So there doesn't seem to be a change in the level of antisocial behaviour, or what's perceived by the public as antisocial behaviour, but it's how we understand what that is actually looking like, and
whether we're crime in it.
And
the ability of community safety hubs to actually deal with that then.
So I think the incidents on the ground, as far as the public are concerned, those incidents are taking place. How we're capturing and recording those is the bit of work that we're doing. So that's why I'm saying we need to treat the drop in ASB with caution of actually the incidents on the ground. So that's why the public are probably feeling the way that you're saying, Tom.
Okay, the bottom left-hand table just shows that violence type offences account for the largest percentage of crimes across the county, which is in line with national trends. And that final table just shows the split of crime across North Yorkshire. So county and city are pretty evenly matched, just under 40%, with the coast accounting for just over 20% of all crimes. This next slide just gives an overview of crimes by type which affect particular areas where the focus is. The things to pick out of this really are in Selby, burglary remains a concern, which has seen a 19% increase compared to this time last year. There's been some recent work with West Yorkshire Police resulting in a number of arrests which will hopefully have an impact on that. And also, drugs offences in Hambleton and Richmondshire have shown significant increases compared to the previous year, the majority of which relate to possession of cannabis. I don't know whether that's an increase around proactivity in that area, or I'd have to do some digging on that.
Well, more people are growing cannabis.
Yeah, in Hambleton. Okay.
Rural organised crime for you.
Yeah. This slide is a focus on domestic abuse over the last 3 years. So domestic abuse crimes are on the rise due to increased crime recording and the addition of secondary or multiple crimes, which will have come out of the CDI review. If you look back to 2018, there were a couple of months that were significantly affected with peaks, and that was July and May. July we can attribute to an increase around the World Cup, and May, the only thing significant in that month really was that there were 2 bank holidays, and it was particularly hot that month, which does tend to lead to an increase in incidents.
I think the one for us to be, so again, projecting ahead, looking at that for as intelligence for us, is we've got the Euro 2020s coming up this year. So again, we'll be anticipating the domestic violence element and what we're going to be doing around actually proactively campaigning against that. And again, and the fire service have done something similar in the past in support of the type campaign as well.
And there's a more strategic issue, isn't there? If this increase keeps going in this respect, there's a more sort of organisational response needed, and one from commissioning as well, and victim services.
Yeah.
So yeah, keep it in place on that.
Okay, the next crime focus is drugs offences.
Yes, we'll skip this one, Charlotte. So Tom will email Phil with feedback on this slide. So whilst it says one thing, the thing we were trying to get away from is drug offences, because that's a very specific. I won't bore the public with the sort of data recording issues around it, but it was a wider question we had around drugs, so we'll come back to that this next month, if that's okay.
So this next slide looks at a breakdown of antisocial behaviour, PSW and KSI incidents. Antisocial behaviour incidents, as we've alluded to earlier, continue to show significant decreases across all commands compared to 2018-19. Obviously we're taking that with some caution. PSW, public safety and welfare incidents, continue to be the majority of all incidents that we attend. But we are starting to see a decrease in the main types of these incidents, which are missing people and concern for safety. So there is a slight decrease in those particular ones.
I think I might ask, so this is not an action because I haven't decided, but a discussion around KSI. So nationally, and I think in North Yorkshire, the number of incidents on the road is about static, but the number of deaths are going up, which for complex reasons. But it might be helpful just to have deaths as a particular subset on here, just to keep a track of. I know it's hard because actually they're quite low numbers, and so you know the percentage increase will be quite high. So it might not be a percentage thing, but just an understanding year on year where we are potentially might be helpful.
And perhaps just a table with the raw numbers, because they are small numbers, and therefore percentages are going to be
exactly not helpful. It's something maybe I'll talk about with John as well.
Okay.
Live chat,
I think in all areas as well, it shows that domestic type incidents are reducing. The next slide just looks at proactivity, what's been taking place proactive-wise. Obviously, we have to take into account that the teams that we tend to use for proactivity can get used for ongoing incidents, so that can detract away from their proactivity at times, but that just gives an overview of what they've been engaged in. So the operational support units have spent a large amount of time dealing with organised and acquisitive crime and border vulnerabilities. Similarly, RPG, you would expect them to deal with a lot of RTCs, and they have done, but they've also spent a lot of time around border vulnerabilities and organised acquisitive crime. And FSU have spent almost the vast majority of their time targeting organised acquisitive crime.
So I didn't have time to do this before the meeting, but I'm just going to check this slide versus the last few months, because I don't remember organised acquisitive crime being quite so well represented previously.
No,
but
I think I would caveat the FSU return there.
And
That looks
not
great,
many hours.
but it's 64 hours and it's dropped off since November. So there's an ask gone into, have we got an administration issue here around that that's not portraying what their actual hours are that they're doing. So the other two areas I think are probably more accurate. The FSU one I would say.
And it's never been all one thing before.
No.
But I just, again, I'm going to go back and have our own look ourselves. Maybe we'll link in with that piece. Just to ask a couple of questions.
Can you read that?
No, but don't worry
Where's
too
it
much.
down?
Yeah, we've got it.
I think you've got a copy, which is the Royal Task Force update. I don't know how much in detail you want me to go into this. I can give you some of the highlights around some of the
Don't worry.
activity.
It's nothing that's unusual there. And
Is that what you would normally?
we keep a good eye on it, and we'd ask.
I don't think there's anything by exception, but there's obviously a lot of
Yeah.
good work around all four areas of the police and crime plan taking place there. And then on to initial contact. This shows the call volumes around 999. So there's been a 9% decrease in call volume compared to December of last year in the last month. But a 17.26 increase in calls compared to January 2018. That increase does follow the national trend, and we've seen the increase year on year, really, as you'll be aware of, around 999 calls. In terms of 101, we've had a slight increase in the volume of just over 2% compared to December of last year. there's been a national increase of 7.6% compared to December of last year for some reason in January, around 101s, which is quite unusual. Anything you want to pick out?
Not on 999s necessarily. I mean, that, you know, I know the control room do everything they can to answer 999s given their emergency calls. 101 obviously continues to be of interest to us. I suppose 6 minutes, whilst sort of frustratingly high, certainly on behalf of the public, is not to be unexpected given the
That's
recruitment
call duration.
Sorry,
Call
call duration.
Yeah.
Yeah, it's 2 minutes
Speed of answer.
52 for
Thank
the
you.
speed of answer.
Is higher than it was in 2018. The point being, because of the recruitment freeze from the middle of last year, sort of starting to bite, as it were.
Yeah.
And then, you know, I know people are due to be starting again soon, but you know, that's the gap we're sort of dealing with now, belatedly, aren't we?
I mean, average call duration,
It
always does
yeah.
creep up because we want more and more information to be able to do an
Yeah.
accurate threat assessment. So it means that the service that they get at the end of it is better because we've got
Yes.
the right information to be able to make.
I know this planter on service desk and other things. to try
Yeah.
and resolve things. First port of call. Tom, did you have something to say? No, sorry.
The speed of answer.
And then the last one is just an overview of the local policing plan priorities per area and how we're performing against each of those in each area, just depending on what priorities they are. And you can see the percentages there. I don't know whether there's anything that you'd like to pick out on that, but there doesn't seem to be anything particularly by
No,
exception.
any cyber stuff, and not that that's unexpected given
No.
where we are, but it is just sort of puts it into perspective.
Yeah.
So no, thank you very much,
Okay.
Charlotte. I think that's that.
And then it's the people.
Oh yeah, people bit. We
Yeah,
actually
yeah,
haven't
people.
gone through that in any depth, Charlotte. So I've
Okay.
got no questions about that, unless anyone has around sickness or anything to say. That's the only bit we've looked at a little bit.
Yeah, just the usual, if we could get that as a comparison rather than against other public sector or organising public and private, but if we could get it against other police forces.
So rather than that one,
Well,
against
we'll think of it. So if we're thinking about adding maybe deaths in and a drug slide, we'll have a concerted effort to just feedback on the slides more generally. So
Yeah.
we'll do that separately. But that's fine.
Okay.
Thank you.
Thank you.
John, you presenting?
Thank you. So this is reporting on our performance from January. Small text, there we go here. In terms of overall incidents, nothing significant to report there. We did 105 incidents. We responded to 505 incidents in January. It was 586 the previous month in December. But there's nothing really standing out there as such in terms of the number of incidents and the types there. False alarms still obviously the larger proportion of what we're doing. 242 of those were false alarms, either false alarm, good intent or automatic fire alarms. And I see that in the York district it's crept back up again down there. It was coming down nicely, so we'll have to have another look at that. The incident overview, fires, again nothing specifically to report there other than when I look at the cause, again the York area, deliberate's quite high there compared to others, so that's certainly something we'll dip into and have a look and see why that is, and we'll compare that to the previous months and see if there's any trends there. But otherwise no major causes for concerns there. We've not had any fire fatalities during January, fortunately.
Tom, what do your flood responses come? Do they come under special services?
They do.
What kind of impact has that had over the last month?
During February,
Yeah.
it's
So
been.
we'll see that next month.
So we'll see that the impact of that one next month. Yeah, and I will try and get a breakdown of that one for you. But they would come within the special service call area. But yeah, I was looking at that myself. But actually, it was in February when the 3 storms had been released.
I know the crews have been doing some really fabulous work around that. So.
It has been tremendously busy. Just to give you a
Not
quick,
just in York either.
yeah, just to give you a quick overview, we had Storm Kiera was the busy one, which I won't say caught us off guard, but I don't think nationally we were very well prepared for what came there. Storm Dennis, everybody stepped up within all partners and really well prepared there. Fortunately for North Yorkshire, it didn't hit as hard, but even yesterday and overnight we've had some flooding down in Selby area, and we've brought in some national assets to help us with that. So it's still ongoing.
Right. Selby escaped quite well, haven't they? Today, apart from.
Yes, so far, yeah.
Yeah.
I mean, York was fairly close as well, and sort of not too badly affected. It could have been a lot worse. But it's been really, a real busy time. Moving on to the home fire safety and business fire safety. Total of 309 home fire safety and safe and well checks undertaken. I know there was a request last time for this to be broken down into the two, but unfortunately we've not got it this time. I am planning some time in to get a review of this, so we will try and get that one sorted for you.
So it's possible, it's just not being possible for today. We think. Okay.
We
we'll
think
wait
it
and
is.
see.
We
Right,
think
okay,
it is
we'll wait and see.
possible
Okay.
to analyse between safe and well part 1 and 2, and that's what we'll
Right.
try and get.
I had another question on the grey box in the middle.
Yeah.
Do we know how many of those are one person ticking all the boxes, or they are separate ticks and boxes? Does that make sense?
Yes, I see where you're coming from.
I'm not sure what value it might add. I suppose it for us gives a scale of vulnerability, doesn't it? If they tick all those boxes, that's a much higher risk than if it's just one.
So it's again something we can look into. I'm going to look at see if we can get that level of detail.
It might not necessarily need to come here, but if you're all doing that work, that might be the reassurance we need.
Yeah.
Can we ask about business safety
Yep.
in terms of Rydale? Obviously, your business safety audits are focused on your highest risk premises and so on. Can we be assured that enough work is going on in Rydale at the moment, in particular, around business safety and making sure that highest risk premises are actually being properly cared for and properly assessed? Is there some assurance that
we will do.
provided?
This theme currently is on licensed premises, and there will be licensed premises within the Rydale area, but hence why you've got more activity really in the York and Harrogate areas, but it's an area I'll be
And so potentially, I guess what you're saying is those that would normally focus on Rydale might have been dragged down into York in order to deal with this large.
Yeah. Interestingly, when you look at the licensed premises there in the outcomes, certainly of the licensed premises we've inspected, over 40% were deemed unsatisfactory. So it's quite a large proportion, is that? Hence, we are drilling into this, and when we look at our prosecutions over the last 12 to 18 months, a large proportion have been within licensed premises. And that's either through fire safety deficiencies or it's risk assessments being inadequate. We've had a number of different problems with overcrowding, so it's an area that we are keen to focus on, and particularly in the York and Harrogate areas.
Well, it might be worth Tom, Fiona and I getting our heads together on that, because Scarborough's equally concerning really. You'd think if it was about licensed premises, Scarborough would be higher up there as well, so it just looks slightly odd the more you look at it really.
Okay. The availability overview, which is the next slide. The appliance availability one on the left hand side where the red is, that is a concern because that's getting into the critical areas where we've got less than 32 pumps, or 32 or less appliances available. And I know over the Christmas period it was quite difficult, a real challenge to support the operational staffing reserve to the right levels. We have got the on-call recruits course, which is one on now, and we've also got 25 new recruits being trained up at Fire Service College, which will hopefully be back out and on their own operational from April. So that should then put us into a better position overall in terms of appliance availability. Nonetheless, the overall availability for on-call is increased from 76% in December up to 80%. So the Christmas period obviously was when people were wanting some time off. And interesting, when you look at the purple blobs on the bar chart there, that's where they were last month versus this month. So a lot of them have improved availability over the last month. But
dare I ask
critical levels.
if at the relevant stations it's too soon to know whether TRVs have made a difference?
Well, I did look at each one of those, and so we've got Summerbridge, Sherburn and Helmsley all on there, and you can see each one's improved.
Yeah.
Now, I can't, it's really too early to say whether
Okay.
that's because of the TRV being or not.
I presume you're generally keeping an eye on the availability of those places.
Are you keeping an eye on the times when they've turned out as 3s as well as 4s then?
Yeah, we've got that information coming to us, yeah. Health and safety overview. Again, no real causes of concern there. Other than January, we had 9 accidents on duty compared to what was an average of sort of 3 or 4 previously to that. So I'm not quite sure why that is. It's still low numbers, but again, we want to dig into to understand why that is. Don't know if you've got any comments on that, James, from a good perspective. Great.
No, nothing that's coming to mind. No, is the honest answer. I couldn't tell you.
So it's one for us to monitor through the Health and Safety Committee. And then causes of concern, we had a dip in December, got it back up to hovering around 11 there. And again, a large proportion of them are down to the MVTs, unfortunately. And then finally, abscess levels, again, nothing really to report out of, which is above the norm there. Long-term sickness is relatively low, and still we are, when we look at our comparators nationally within the fire service, we're on the right side of the chart. Looking at the long-term sickness on the on-call stations, it says 31 for Ripon, Selby and on-call, and that's because there was one person at each of those stations on long-term sick for the full month, so that's how that looks. Happy to take any questions at all.
None on that, thank you.
Thank you.
Right, everybody, thank you very much for everyone's time and effort in producing those reports. Thank you very much. Simon, we're on to questions from the public.
We've had none.
Right. That makes the very next quick couple of items. So any other business, anybody? No? Okay, thank you. Meeting closed.
Thank you.
Okay.